Next up, case presentation methods. Next up will be coffee break after this.
So I have a system of how I present. Basically, I like how I lecture. All right. We use the medical model. So we explain to the parents how we work out the plan. All right. What do you want me to do? What aren't you happy about? Let's have a look at the medical history. We're going to do our clinical exam. We're going to figure out what tests to order. We're going to make a diagnosis, an etiology, a diagnosis. Then we're going to set some goals. How straight do you want them? How many teeth do you want in? We're going to formulate a treatment plan. And then every few months, we're going to revisit, see how we're going. And then when we've got to the end of what we can do, we part our ways. My philosophy is treat early or treat late, never treat in the middle. The worst possible time to treat a child if you want their face to be good is puberty. So I treat before puberty, and then after puberty, I treat surgically. Assuming we're talking about a skeletal problem. Dental problem anytime, right? It's whatever. If they're class 1 crowded or spacing case, 13, fantastic, fine. But if it's a skeletal problem, I treat early, I treat late, never in the middle. You must take better records than the orthodontist. That's all it is, right? This is basically all I'm telling you to do. Take better records than the orthodontist. Take better photographs. Do a better analysis. Explain it better. Show them where all the soft tissue marks are. I teach you guys how to do all this. I teach you how to overlay the Bolton norm so that we can show the parents, can you see how the skull is almost perfectly normal? All right, so the length of skull is perfect. The eye socket's exactly where it's supposed to be. The forehead is perfectly lined up. The jaw starts off perfectly. Oh, do you ski? You say. How else are they going to know? How else are you going to know? How's that possible? Did you know we have a misconception about the jaws? We think they're paired structures. Who thinks jaws are paired structures? Top jaw, bottom jaw, it's a pair, right? Did you know only left and right halves of your body have pairs? Put your hands together. They're a pair, right? Measure your ears. They're a pair. Everything on left and right of you is a pair. Front left tooth, front right tooth, pair. Lungs, pair. Lungs and heart, they a pair. They're a neighboring set. The maxilla and the mandible are completely different. Anything in the vertical plane are neighboring sets. Who thinks the maxilla and the mandible? One is a series of small complex bones stuck to the skull, and one is a long bone stuck to the tongue. Who thinks they're a pair? They're a set, neighboring set. Did you know they're actually not designed to grow exactly the same? It's like saying, why does my hand not grow like my skull? Why is my arm not fitting over my head? We're actually not designed to grow maxilla and mandible together. Let me tell you what a maxilla and a mandible is. They're not twin siblings, right? Your hands are twinned siblings. Your maxilla and your mandible are husband and wife. if you close your mouth, put your lips together, teeth together, tongue touching the roof and the floor at the same time, you complete the circuit and you become a married couple. If you sleep together, you will grow as one. Does your child sleep with their mouth open? Yes. Two ships passing in the night. They cannot possibly grow together. Why? Oh, have you seen the size of the tonsils? Yeah? There's a reason. Then we explain to them, this means nothing to you at all, but it helps me understand. That's all you have to say. Red is not good, black is good. There's more red than black. Let's investigate further. We're starting to get a sense of how big the new teeth are, and they are much bigger than the space that's present, right? We've got a crossing of the bite. Think the new one's going to fit? Don't think so. You've got to have really good records. You've got to have a really good understanding, and you have to explain it in this length of time. How long has it taken me to help you understand maxillary and mandibular growth? Do you get that they're sets and not pairs? You get that they're never going to grow together unless you put them together. You know that the only time you grow is in childhood at night, right? So if you don't sleep with your mouth shut, they will never pair up as a married couple. Big teeth, little space. We have reason to do something. That's it. That's your case presentation, huh? And they'll say, oh, what are we going to do? Then you talk about the plates, you talk about the exercises, talk about how much it's going to cost, how long it's going to take, and how much you're going to yell at them for not doing the exercises. And then I show the kids who didn't do the exercises, and I show the kids who did do the exercises. What are you going to be? What kind of family are you going to be? Well, we'll do whatever it takes. I will do whatever it takes. I said, yeah, you say that, but put your money where your mouth is. It's going to cost you $9,000. You've got 18 months to pay for it. Are you okay with that? So we work out a contract, we work out a consent form. What do parents want to know? What does anyone want to know? What's my problem? Can you help me? How long will it take? How much will it cost? Answer those 4 questions, and they will have enough information to do their due diligence and come back to you and say yes or no. If you don't answer those 4 questions, they will have more questions. They won't have the information they need to answer the question. You think about it. Anything, any purchase that you make, any decision that you make, tell me if you don't have those 4 answers, you can't make a decision. Like we as dentists who are thinkers, right? What do we say? Let me think about it. So you say, have I answered your problem? Question of what's wrong? Yes. Have I shown you that I can help you? Yes. You know how long it's going to take, and you know how much it's going to cost you. You've got enough information to make decisions now? Yeah, great. Here's the contract. We'll send you the PowerPoint PDF of your child. We'll touch base next week. Wonderful. Oh, but we sleep on it. You've told me you've got enough information. Do you have any other questions? That's it. That's your treatment plan presentation. Make sure you treat only at the beginning patients who love and trust you already. And that is case presentation method.
All right. So that ends that segment.